The safe use of medication during the COVID-19 pandemic. Introduction to the module. During the pandemic, patients and their families' experiences with handling drugs safely varied widely. If there is a need for the use of a patient's own medications in a suspected or proven COVID-19 patient, self-administration under appropriate observation is preferable to nurse or midwife administration. Hospital-issued drugs for COVID-19 patients should be placed in the ward's medication room or a lockable medication trolley, rather than in the patient's room, to reduce the possibility of contamination with SARS-CoV-2, novel coronavirus. Learning objective. After completing the module, you will be able to realize the pros and cons of the role of a social care worker amid the pandemic for ensuring safe medication to the patients. Compare and contrast between prompt and assist. Identify additional safety during the administration of medication. Review COVID-19 guidance for all regarding safe medication administration. The role of social care workers. You as a social care worker can help patients with medication in a variety of ways, depending on the care setting, your role, and your level of responsibility. If social care workers have any questions about any particular medicine, you should speak with your supervisor or manager as soon as possible so that you have a clear knowledge of what is expected of you and what steps to take. Suppose social care workers are assisting someone in their own home, there may be various expectations surrounding your care position. Social workers are responsible for providing one or more of the following categories of assistance. Prompt. Remind someone to take their medication using their preferred communication method. Assist. Help someone who manages their own medication with physical tasks like opening bottles at their request. Administer medication. Prepare the right medication at the right time and support a person to take it in the right way according to their care or support plan and advice from the prescriber or pharmacist. Prompt and assist. The drug should be given to maintain or improve the person's quality of life, according to an underlying principle of medication support. It's critical to recognize your position as a supporter in reminding, assisting, and empowering individuals to take their medications. Your work environment may have an impact on how often you assist people with their medicines. If you work with clients in their homes, they are usually in charge of their own medicine storage. While some residents in residential care may opt to store and administer their medications alone, it is more probable that the care provider will be in charge of more areas of medication management, including ordering, storing, administering, and monitoring medicines. You may come into close touch with persons who require pharmaceutical assistance. COVID-19 is spread directly by coming into close contact with an infected person within 2 meters and indirectly by touching an infected person's hand, surface, or object. When providing medication to individuals, infection prevention and control steps are necessary in order to prevent the virus from spreading to keep yourself safe. Prompting. Reminding someone of the time and asking if they have taken or will take their medications is known as prompting medication. The person still has control over their medications and can decide whether or not to take them. When a person knows what drugs to take and how to take them but forgets the time, prompting can be helpful. The choice of whether a person requires medication prompting should be discussed and recorded in their care plan on a frequent basis during person-centered dialogues. If you're supposed to remind someone to take their medicine, the specifics should be included in their care and support plan. If you have any concerns or believe a person requires additional assistance, or please contact your line manager, who will be able to schedule a follow-up meeting with the individual, their family, or carers as needed. Assisting. The patient's care and support plan will indicate whether they are able to maintain control of their medications while requiring assistance with specific chores. It's vital to remember that care and support plans should be reviewed and evaluated on a regular basis to ensure that they're still meeting the needs of the person being supported. Assisting with medicines can include ordering repeat prescriptions from the GP's surgery, picking up prescriptions from the GP's surgery, collecting dispensed medicines from the pharmacy, bringing packs of medicines to a person at their request so they can take the medicines, opening bottles or packaging including multi-compartment compliance aids at the request and direction of the person who is going to take the medicine, reading labels and checking the time at the request of the person who is going to take the medicine, ensuring the individual has a drink to take with their medication. It is very important not to just handle any medicines. You need to prepare them with a clean technique. This may include washing your hands first, pushing a tablet or capsule out of the blister directly into a clean medicine pot. Some medicines may be harmful to the worker if they have direct contact with the skin. You should avoid touching medication in general, although if you have to, you should wear gloves. Administer medication. Administering medication is the process of preparing the right drug at the right time and assisting a person in taking it correctly. Not every social worker will be able to provide medicines. Many social service personnel are responsible for administering medication, such as tablets and capsules, and will receive necessary training from their company or organization. COVID-19 guidance. In the midst of the pandemic, useful information for employers and social care workers regarding the proper way to administer medicines is required. Supply of medicines in care homes. The medication documentation at your care home will outline who is responsible for ordering repeat and non-emergency acute medications. Prescriptions are viewed by care homes before they are dispensed by the community pharmacy to ensure that the prescriptions match what the facility has requested. The community pharmacy service frequently carries these prescriptions from the doctor's office to the nursing home and then picks them up once they've been checked. Due to increased strains on GP and pharmacy services during the COVID-19 pandemic, some pharmacies may be unable to perform this transportation duty, and medicines may be automatically transferred from the GP to the pharmacy to save time and limit the risk of infection spread. Repurposing medicines. It is the obligation of providers to guarantee that drugs prescribed for one resident are not consumed by others. However, the COVID-19 pandemic has made it more difficult to obtain palliative care medications, especially restricted substances. The reason for this could be the fragility of the medicine supply chain, locally or nationally. The term repurposing drugs refers to a circumstance in which a medicine prescribed for one resident is given to another in order to provide prompt treatment when access to medicine is not attainable through conventional channels. If a situation arises where sharing medicines between care home residents are in an individual's best interests, care home personnel and prescribers are required to weigh the risks and benefits in accordance with the guidelines. Just-in-case boxes in care homes. The just-in-case (JIC) box is a box containing medicines that, among other things, are very effective in treating pain and sickness when administered into the skin via a needle and a special pump, syringe driver. JIC boxes contain the most important medications that may be needed to address predictable and bothersome symptoms such as pain, muscles relaxation, anxiousness, etc., when the client is unable to take vital oral prescriptions. The drugs in the JIC box are usually prescribed for specific individuals. Some of these medications can be restricted substances, CDs, and should be kept in a secure, locked location. Opioid substitution therapy. Some people who would ordinarily receive opioid substitution therapy, for example, methadone, on a daily, often monitored, basis from their pharmacist may be allowed a bigger supply to take home as a result of the COVID-19 situation. If any persons can be vulnerable as a result of receiving a bigger supply, a risk assessment of each case should be conducted. The safest solution may be for the service to store the drug in a secure central area rather than with the individual who holds it. The medicine must be signed into a secure central storage facility and a proper audit trail must be kept. If the care service does not have responsibility for the client's medication administration, they can sign a daily amount over to the individuals so that they can self-administer their medications. Highlights of the module. When a person knows what drugs to take and how to take them but forgets the time, prompting can be helpful. Administering medication is the process of preparing the right drug at the right time and assisting a person in taking it correctly. The community pharmacy service frequently carries these prescriptions from the doctor's office to the nursing home and then picks them up once they've been checked. The COVID-19 pandemic has made it more difficult to obtain palliative care medications, especially restricted substances. Thank you. You have reached the end of this module.